Thank you so much for the invitation to be here. We really appreciate this opportunity to spend an hour of your morning with you. So I direct BetaGov, and really the purpose of BetaGov was exactly what you heard during Layla's introduction, is how do you get people in communities integrated into the research process? And practitioners who are working with communities, service agencies, people in government agencies, people in nonprofits, are the closest to the communities they're serving, and therefore often closest to the problems and to candidate solutions. So often we tend to seek so far out for our solutions where they might be right under our nose. So the goal was to really think about ways to make it easier for people to start solving problems right where they're at. And that really was the goal of BetaGov. So I'm going to see if I can progress here. We are housed, so we are a nonprofit. We're often asked what is this thing BetaGov? We are a nonprofit by virtue of our affiliation. We are at NYU, so we're really a research group housed within the Marion Institute for Urban Management. We're a little unusual for an academic team in that our only responsibility every year when we report to the provost is impact. We have to demonstrate to the provost what is working differently and ideally better as a result of the work that we do. And that really informs everything we do in the communities that we work with and the agencies that we work with. And it does affect our timeline. We need to make sure that we can help agencies try something and ideally get to some sense of whether there's a signal, whether it's a thumbs up or a thumbs down, but that there's some signal around what they're working on. So what's working? The truth is we don't know, and mostly we don't know because we know some, but we don't know a lot. And the reason we don't know a lot is that we've made it very difficult to learn. So most of the practices that we have in place have never really been assessed. So we don't really have good data to indicate whether that's actually a good idea or not. So many maybe harmful policies and practices are persisting because we just don't know. And so evaluations, especially if we think about the programs and practices that we're using in our communities, have usually involved professional outside researchers. External funders have to pay for that effort. Lots of red tape, which slows us down a lot, and therefore long timelines, so that the policies that are supposed to make us smarter, safer, and healthier usually are more based on history. We do it this way because we've always done it this way. There's some manual somewhere that tells us to do it this way. So it's just this inertia that comes along of just persisting in doing what we've always done. And some of those are good things to do. Sometimes you want that history to stick, but sometimes you don't. And other things we do are based on our guts, right? Our guts are telling us this is a good idea. This just feels right. And well, you want what you're doing to feel right. It has to pass some sense of this is a decent thing to do. But that it feels good doesn't necessarily mean that it does good. So even if something feels like a great idea, go ahead and test it. Let's get some data around that to convince yourselves and the communities that you're serving that this is indeed a good idea. We have a long list of pilots that we've worked on with agencies that just were they thought it was so obvious that this was a great idea until we actually took the data around it or collected data around it, and very quickly they transitioned to something else. So evidence-based programs and practices, I'm sure you're all steeped in this thinking and this approach, and of course we're university-based, so we love, see our hearts, we love, and evidence-based and growing that body of evidence. But there's also a cautionary tale there, and that is that some evidence-based programs and practices are kind of E. We have to worry about that E and the quality of that E. Some evidence-based practices are based on truly phenomenal data and solid, rigorous work, and others less so. And sometimes it's hard for a practitioner to differentiate which EBP has a really strong evidence base behind it and which does not. The other challenge we find is what we call the challenge of transferability. Places are different, local communities are different, so that if you're selecting a practice, even if it's based on really outstanding good quality evidence, and you're implementing it in your community, it might not work the way it did in that community over there where it was scientifically tested in. So that even if you're taking on something that is deemed an evidence-based program or practice, even with good quality evidence behind it, you want to make sure you're still keeping data around that new innovation or that new practice when you're trying it or testing it or implementing in your own community. And then I always tell everybody, even if we're relying solely on EBPs and existing stock of fantastic evidence-based programs and practices, always please keep room for something new, because things are changing all the time. Things can be improved. There's always room for improvement. So don't shut down that creativity just because there's something on the shelf that you can take. Keep space for your staff and the public you're serving and yourself to keep thinking in terms of this problem-solving approach of looking around you and seeing what you can be doing differently. So if we become very serious about wanting to know what's working and what isn't, we have to make it easier to learn. So this is our big plea to everybody we're working with now, is really think about a homegrown evidence. So there's a body of evidence, there's a research literature, a body of evidence-based programs and practices, but what about where you're at? What about in your city or your town or the jurisdiction you're in? How about creating a homegrown evidence base specific to your community? And also, I like the language now of what we call EGPs, evidence generating practices, that when you're trying something new, but you're collecting evidence around that, you're generating new evidence as you go. So this was the challenge we saw, and really kind of the reason why we created BetaGov is that the traditional academic research we were involved in was taking a very long time. And there were lots of reasons why at every step along the way, there were these kind of reasons for it being slowed down. And some of them were good, but some of them didn't need to be that way. So research in criminal justice, for example, when we started to look at the literature, it was like 4 years ago when we were looking at our federally funded studies. Well, on average, a crime study was taking about 5 years from the time someone submitted the idea until they wrote about it. But our police chiefs were turning over every 18 months, and our secretaries of correction running our prisons were turning over more quickly than that. So when the research finally came out, it just wasn't relevant to the person who was making the decision because they had moved on several times since then. For health, for those of you interested in health, it was even worse. On average, around 7 years from the time something is submitted until the results are published. So the timelines are starting to tighten up a little bit, but there's still lots to do in terms of making sure we can help decision makers or help you figure out what's going on in your backyard on a slightly more aggressive timeline than that. The other issue is research costs money. Traditional research, the more kind of heavy academic research, costs a lot of money. And when something costs a lot of money, you can only do a little bit of it. I mean, you can only do a little bit of it. You create a monopoly over who gets to weigh in on what gets tested. And if you don't get to control those research resources, then you never get to have a voice in figuring out something new that might work. So we wanted to shatter that monopoly, make it easy for anybody who's working in a public-minded enterprise to be able to have a good idea, raise a hand and say, let's try this. Can we try this? So our approach to fostering is really about fostering learning organizations. How do we create a culture within organizations where staff are empowered to learn, have the tools to learn? And we thought about doing this through something we call pracademia. And now we've actually formalized this process at NYU. We have a pracademic credential for our pracademics who work with us on the study. And pracademia is just this idea of it's a practitioner who's also a researcher, that they're doing research. Even if they don't have a formal background in research, they're becoming part of this learning apparatus within their organizations. So pracademic is just a practitioner is also involved with research. The idea with pracademia is really to kind of have a tangential line. We have our formal traditional academic enterprise, which is extremely valuable. We're not suggesting that that should go away. There's great value in the slower, more expensive traditional academic enterprise too. But we've thought about pracademia as being something on the side that's really complementary to that's much more practitioner-centered, it's more nimble, and can inform the other more traditional academic approach of strategies that might be worth looking at with those much bigger, heftier studies. So we assist pracademics and we approach it so that they can do this learning where they're at and really promote this approach of kind of data-driven innovation and testing. And that includes what we call pragmatic randomized control trials, or RCTs. Now you say RCT and randomized control trial, and that sounds very complicated, but the truth is it isn't, and that with just a little bit of help, anybody can do research, and that absolutely means you too. And even if you do or don't have, if you have a great background in research, that's great. We have lots of pracademics who do, but if you don't, that's great too. We have lots of pracademics who don't. So our mission really is just this fueling of organizations that learn and empower their people to learn. And that has, there's several pieces to that. There's this idea of just raising the awareness of the value of data. And we always say, this actually was Michael Bloomberg always used to say this, and we've stolen it from him. It's easier to manage it if you can measure it. So if there's data around something, it's much easier to know that you're headed in the right direction or know where to move. But to to be valued, data has also got to be shared and used. So your staff or your agency will be better at collecting that data, ingesting the data. People will do that extra work of putting in the data if they know it's going somewhere. So reporting back on data is absolutely essential. And some really good research on that, even in data centers, about how when data is reported back, or the results of that data is shown to the people who are responsible for collecting data, they're much better at that job of inputting the data. So make sure you have like data-rific extravaganzas, make sure people know data is important, that they should collect it, and that it's something that's really valued and used. We also really like to work with organizations that are pilot testing practices that have been shown to work elsewhere that might work in their backyards. But then even more than that, we love this idea of working with organizations to pilot test something that is completely homegrown, is the initiative of someone in their own backyard or within their own organizations. So we love this idea of encouraging organizations to nurture their own local talent too. We often find that there are these little mini frustrated, citizen scientists within our agencies, and just with a little bit of encouragement, this extraordinary kind of body of research can flourish within organizations. So the idea is to really just let staff know that their ideas are valued, their participation in research is valued, and to ask them to look around their workplaces and to be empowered to ask the question of, is there something we can do here? And especially in COVID, a post-COVID world with budget cuts, this is a reasonable one to ask staff. Is there something we can do here that could be cost-cutting without compromising our programming or our service delivery at all? And we've seen lots of those sorts of examples where people make these submissions of just, hey, we can do this, and this is going to save us, X number of dollars, and it really doesn't make any difference at all. Or look around your workplace and think about our programming. What might we be able to do in our programming that you think could make a difference? So basically empower them to ask the what if question. What if we did this differently? And then also clients, the community that you're serving, well, they know a lot about themselves. They know a lot about what's going on in their local jurisdictions, their local areas. Reach out to them and solicit their voice too of, what do you think we should be trying? What do you think we should do? If you lean in and listen, it's really inspiring what we can learn from them. And especially if you let them know that their ideas will be, will really become candidates, thoughtfully become candidates of something that might be tried. And then finally, data-driven innovation. We really do like to start engagements by, if there is data, looking at what the data has to say. Sometimes we found that we work with an organization and they're solving the wrong problem. And if they had spent a little time understanding their data first, they would have recognized that, and it could have saved us all a bunch of time, because we could have started off pointing in the right direction to begin with a candidate solution that's solving an actual readily identifiable problem. So fear not your data, embrace your data, bring in your data. It's often very telling about some directions. And then also it tells you where you're missing data or don't have data. And being a data desert, you have to start somewhere and just create the first data if you don't have any. So a little data dive on the front end can go a long way. And then I think very, very important, it's always, what are you positioning to? What are you hoping to drive towards? And that really starts with a conversation, and just an honest conversation within your offices of, what does success look like for us? What do we mean by success? And because the challenge we often find is that, especially when it gets to kind of evaluation work and figuring out if something's working or not, is we tend to count what's convenient. We tend to count what we have. So if there's data, that's what the outcome measure is going to be, because that's where the data is. And we have to be a little careful of that. Sometimes the important things are in our data and we can go at it. But sometimes people will orient towards what you're counting too, and in a way that might have unintended consequences. So you have to be a little careful of that. And we have some horrible examples recently of a very well-intended prosecutorial reform project of another university that was put out that was evaluating prosecutors in certain dimensions, and actually ended up having the reverse effect, because prosecutors were gaming to an outcome, or could be potentially gaming to an outcome measure that's actually counter to what that group was hoping to do. So we have to be careful what we count and know what it is we want to think of as a measure of success. So starting with that conversation of what success looks like, and then really thinking about data collection. So you decided you want to go for it. You want to get into put this learning cap on. So decide what it is you want to test. Is it some program? Is it an existing program? Is it a new program? Do you just want to test something that you're already planning to do and you want to just put some data around that? Is it some process that you want to assess whether that process could be improved? There's lots of great opportunities to do process improvement studies. And then, so how are we going to go about testing this? And I'm going to walk you through some examples in this session. What we always do when we start a conversation with a new group that we're working with is really think about what is the most rigorous method that you can use that is feasible. So if it doesn't pass the it's practical, we can actually do this test, then take it off the table. So it has to be feasible, it has to be ethical. Obviously, it's an obvious one, but you really have to go through that thought process. And some of you will have formal policies for that, others won't, but we'll always make sure this is guiding ethical lens in everything that's being done. And then, can we produce insights on a timeline that's relevant? Is this an opportunity to do some learning in a timeline that makes sense for some decision maker or for that organization? And then very importantly is when we're thinking about doing evaluation research is where is that comparison going to come from? Now, in a randomized control trial, that's nicely packaged for us because we have an intervention group and a control group. But sometimes you can't ethically find a way to do a randomized control trial, or it's just not feasible, in which case we have to find out where's that other apple. And we want to make sure we have an apples to apples comparison. Where's that other apple going to be coming from? What are we going to be comparing against? Because we really want to make sure we're drawing conclusions that don't misinform us. And then another conversation is around duration. How long does this have to run for? How long do we have to have the study in place for us to be able to get the right sort of signal, a signal that indicates whether this is working or not? And we've had some studies that lasted hours. We just had to run them for hours. Others, a couple of days. We did one on an implicit bias study on policing that lasted 2 days. We have a priming study lasted just a few days. Sometimes it's weeks. Most typically our studies last a few months, but others, there's no way to do them without waiting for years. So it really depends on the nature of the work that you want to do. You'd have to sit down in your teams and really think through what makes most sense given the issue or the topic that you're studying. And then at the end of that outcome period, at that follow-up period, really think about how did intervention do versus how did control do. Now, this is where we depart from the traditional academic model. In the more traditional academic model, you don't want to look at outcomes until the end of the study. And that because, well, what if looking at outcomes might make you feel more enthusiastic about one intervention versus the other? And you kind of hold that study in place until the end. We really increasingly recommend that you do keep an eye on study outcomes if you have them easily available and it's easy to do along the course. Because we've often found things where agencies went into trying something that they thought were no-brainers. This is an obviously good idea. And by the time we got to months 2 or 3, we were shutting it down. And they would have, in a more traditional academic study, have waited until year 3. And you can do harm, right? If you're testing something or you're trying something or you think you're starting a new program that's going to work wonders and it doesn't, you want to be able to responsibly say after 3 months, we had good intentions here, but this was not something that was serving our community well. We either need to modify this or we need to do something differently. Now, not everyone shares that opinion. That's an opinion we have. We do like to look at data at regular intervals if it's available to make sure that we're on course towards an improved outcome for your community. Right, so here's an example just to get to something quite specific. And I'll walk you through a couple of examples and then talk a little bit about the detail of how kind of the BetaGov process works. So this is an example. It's called the chill plan. And it's actually one that I'm very fond of. So I like to talk about this one. And the setting here is a close security. And that's for those of you who aren't familiar with this, close security means it's a nicer way of saying very high security. So it's like maximum security. Diagnostic center for women with psychiatric disorders. So these were women who have serious psychiatric disorders, and there's lots of misbehavior, in fact, a lot of violence in these living units. And the problem was this large number of misconducts. We were brought in to work with this agency to really reduce the use of kind of isolated housing, keeping women in congregate programming, keeping them able to be engaging with others is very helpful for their treatment plans. And when the misbehaviors accumulate too high, it becomes very tough for everybody because everybody has to be separated from each other. So the idea was, could they start to test strategies that would reduce the number of misconducts to keep everybody safe and also on path on their programming? So the response was that they got together, and we love collaborative design, where people come together with people who were on the security side, making sure the women are safe. people from mental health, the counselors, all the staff came together, input from women who had been in this sort of programming unit, all came together to design a homegrown program that they were then going to put to a test to see if this new program would reduce the misconducts. And what the innovation was a crisis prevention plan that really empowers women to preemptively manage their own anxiety with their own personal response plans. So this was truly an innovation. In fact, I don't know of anyone like it in any of the facilities we've worked with. And for those of you who've ever had a birth plan or know of someone who's had a birthing plan, essentially you go to the hospital with you're about to have a baby, and the doctors know how you would like your birth plan to unfold. And that gives you a little bit of relief knowing that this is what I know what's going to happen. Well, with the chill plan, the woman knew exactly, they could trigger it. They could say, I would like you to invoke my chill plan. This is what I would like you to do when I'm experiencing an increase in anxiety. I can feel I'm escalating. This is how I would like you to respond. Well, they tested it. We helped them run the experiment. They tested it with 238 women who were entering the unit. They were randomized to being informed of the chill plan, given an opportunity to draft their chill plan. 70% of the women chose to do so. This was what's called an intent to treat randomized control trial. So whether they drafted a chill plan or not, when they had the offer, they were counted as the intervention group and they were compared against the control group. And the outcome measured there was misconduct, which was already maintained in administrative data. So there was a data source there for this study, which made this one a little easier to do because there was a clear data point that could be compared at the end of the study. And just this is the point of this was not to tell you about outcomes, but to really the process that went into this. But the outcomes of that chill plan study, which has since been replicated and held up, was that the women who were given the opportunity to draft their chill plans had significant reductions in subsequent misconducts, these sort of serious misconducts that have to be rose to the level of being written down. We love the sorts of interventions that are kind of micro environmental design, like small, sometimes big, sometimes small changes. Big changes are great. Even little ones can make a difference in terms of thinking of the spaces around you. And this could be out in the streets, thinking about something that you're going to do on the outside space, but also on the inside space. So we've been testing these sorts of changes, and they do lend themselves to kind of these sorts of sometimes really quick little evaluations of whether those changes are making a difference. So we've tested color palettes, we've tested changes in lighting. New York City just finished a relatively large scale randomized control trial of street lighting. We've tested in different environments what happens when you introduce soothing sounds, what happens if you introduce nature elements like fish tanks into a place that might otherwise be a place of somewhat high anxiety. How about bringing in just diffusers and lavender, which there's a great scientific growing data around the soothing effects of nature of lavender. And so we've been infusing lavender in different situations and seeing if it makes a difference. And these are all kind of micro changes. We have a multi-state project right now, which we're calling Nature Box, which is introducing really a collection of kind of nature-based elements into environments that have problems with violence, and to see, and we'll know, hopefully a year from now, if COVID lets us get out the door again, whether those made a difference. And many other agencies we work with are interested in the theme of staff well-being. And in fact, if they aren't, we always encourage them to be interested in the theme of staff well-being also. We remind them that their staff can't engage well with the clients that they're serving, the community they're serving. We can't expect them to have healthy relationships with the public if they themselves aren't healthy or aren't well. So this is an example of one of the studies we have from that body of work. This was an officer training facility in Pennsylvania. And the issue here, these were officers who are working in stressful environments, and that, if you have a stressful job, that kind of the chronic and long-term job stress leads to, there's a host of evidence on this, of the negative outcomes that it leads to. There's burnout, there's productivity losses, absenteeism, just this pessimistic weightiness with which this person kind of navigates their work environment, and then the psychosomatic diseases too. So the response there was like, this is an issue in our agency and in the clusters of our workforce. We want to respond with an intervention that's aimed at stress reduction. So they conceived the pracademic set out, these are the people in the agency are now setting out to think about how they want to respond to this issue that they've identified within their organization. And the innovation that they tested was just, they worked with, they tried a program from the Brain Institute. It was a mindfulness program. It takes 13 hours to complete over a course of 4 weeks. and they did not. So we call this a pragmatic RCT. This is a small randomized control trial, 56 people on staff. And the purpose was here to really just learn about how to do this sort of testing with their staff too, so that they can do lots of other wellness testing. How do we do a randomized control trial? What are all the processes involved? So this was, for them, their first pragmatic field experiment of trying something on staff wellness. And the outcome was, the outcomes here were standardized questionnaires that were administered at baseline and then at follow-up to the group that was randomized to receive this mindfulness intervention and the group that was not. It included stress, fatigue, resilience. Actually, there was a host of outcome measures that they were looking on, both at the intervention group and the control group. But the point of this one is that that did not come from data in an administrative database. There was no data on these outcome measures. In fact, they did have absenteeism. That was the only one that they had in administrative data. These other measures were measures that we would help them create the instrumentation around this, and they had to collect, the data had to be collected as part of this project. So the first example, the CHILL plan, relied on administrative data. No one had to get into the business of data collection. For the second one, new data had to be created for the purpose of that study. So while we're thinking about how to do these kind of tests in our business places, our workplaces, I want to just kind of point out other sorts of studies, or other sorts of topic areas that can very readily lend themselves to kind of evaluation research. So that if you're introducing something new, we always ask you to just press pause. We won't slow you down, but think about how to wrap around data collection exercise into this. So new technologies, if you're ever adopting a new technology, really lend themselves well to experiments that can be ethically conducted, and you can do them on a relatively close timeline. So we, for example, have been doing lots of tests on, virtual reality is growing in use in the US and other parts of the world. So if an agency is thinking about introducing virtual reality, we're working alongside them to test whether that technology is actually improving outcomes. And there's lots of different application tools we're testing, and you could be doing these too. VR is being used as a training tool, as an incentive, as a way to communicate information. Think, for example, if you have a youthful group that you're working with, you can either sit there and tell them something, blah, 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 or make them read a handbook and blah, 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 or you can put them into an immersive headset experience, and you're much more likely, they are now a captive audience in the headset, and much more likely to consume the information that you're feeding them. Mindfulness applications, if you have staff in stressful job situations, 5 minutes of a VR headset, taking them scuba diving or into an ocean scene, can really bring things down, as in bring down the stress levels. And we're also building out a whole new line now of experiments looking at VR applications for people with substance use disorder. Another technology that everybody's using is kind of smartphone applications, or just regular phone applications right now. If you go to the dentist, they're sending you an appointment telling you to show up tomorrow at 3 o'clock. I think a lot of agencies are moving in this direction. We were really among the first to start in the US testing these kind of really quick, doing these quick tests of even text messaging to get people to show up for their appointments, whether it's an office visit, if they have to take medication, and they're people where there's a public benefit of keeping them on their medication, if it's antipsychotics, or if they have some other medication that they need to take, there might be a really good social value in keeping them connected to their medication. We did a study on medication adherence with a cell phone check-in that really pushed up adherence with that medication. Unhoused, this was the one in Seattle. We're helping unhoused families move into appropriate housing more quickly by staying constantly in touch with them through text messages. So there's lots of ways that you can do this. The snapshot is one of our first ones, which was someone from probation in Oregon. If someone didn't show up for their probation appointment, an arrest warrant would go out for them. Or if they didn't show up, they would be required to, if they didn't show up a couple of times, but if they didn't show up even for one appointment, there would be a mandatory, very brief 1-day sanction or 2-day sanction. So they wanted to avoid the no-shows and use text message reminders. And there was a dramatic reduction in the no-shows for that agency, which was really quite consequential because the alternative was something quite draconian. We have been encouraging agencies to just think about space and think about these kind of micro changes. And this really belongs in kind of our microenvironment one. So this is an example of a line of sight study we started in Canada and then shifted to Mexico too. We were working with communities that had seen a rise in business crime. So these are kind of convenience store crimes. Think about, I don't know what your local, we have them, they're called 7-Elevens, they're everywhere. You'll have your own kind of corner store. The sorts of crimes that would happen are, they're coming to steal a cell phone or alcohol if they sell alcohol there. Certain things are just kind of routinely taken from these stores, and often they might involve a weapon. So in Canada, it was knives. In Mexico, it was knives and guns. But the idea was, how can we make sure that the staff in these stores are safe? Because if we're keeping the staff safe, it means that people aren't committing these crimes there, which means we're keeping the community who comes into these stores safer too. And a very simple intervention was called the line of sight intervention. So if you're passing the store, often these stores are littered with kind of the cigarette ads and the beer ads. Well, what happens if you just create a window of space on the glass that provides a direct line of sight to the cashier, or to with the space in that store that's causing those problems? So those are just a simple intervention, a line of sight intervention. So some of these interventions can be a really small deal. Just take off some of the ads and put a red frame around it, and you got yourself an intervention. Some interventions are big deals. Sometimes they just aren't. They can just be these small things, but should still put a test around them to see if they're working. So this is meant to be a trilogy. By now, we should have been able to show you part 3, but because of COVID, number 3 was shut down. This is a suite of studies we're doing in a community in Queens. This is Queens, New York, which is a high poverty, in this community, really high poverty, lots of risk factors in this community. And we're really focusing on children who are at risk of poor outcomes. And the first study was really just, how do we engage parents? How do we get parents to be more engaged with their children and making sure that they're in school and on track? The kids who are falling behind, not doing anything in school, how do we get parents more involved? So we ran through the first 2. The third one, which is actually my favorite, we're about 3/4 of the way through it, was chronic absenteeism. So working with schools where about 1/3 of their students are missing at least 1/3 of the school year, because they just don't show up. So there's major truancy problems. And the intervention there was really, how do we start resolving this with an intervention focused on parents? And well, stay tuned. We hope that results of that will come out soon. But again, it was integrating with the community, identifying the pressing issue for them, coming up with strategies, and then working with them to test those strategies. Something we always want to talk about when we talk to our partners is the importance of trying, because we're only going to move the dial, move the needle to improve outcomes for the communities we care about if we are trying something new, and we are testing the programming that we're using in our communities. But it's very important that we also make it possible to fail cheerfully. And it seems strange, like this idea of failing. Why should we celebrate failure? Well, the idea is that there are good, responsible ways to fail. And there's a quote from somebody whose name I can never remember, who said, nothing important can ever be done without the ability to fail cheerfully. So the idea is that, and if you aren't doing anything, if you're doing something, if you're really doing something important, every now and then you're going to fail, and you can learn from that and move on. So that's the idea of really embracing failure, but doing that in a way that's responsible. And for us, that means that keeping data around something. If you're trying something, that's fine. If you're working on programming, making sure your programming really is serving your goals. Keeping an eye on data that's in a timely way, so that if something isn't moving in your direction, the opportunity to modify it or shut it down and try something else. And then the willingness to share that information. We find so many agencies, when something doesn't go their way, they kind of pretend it never happened. And what happens then is that sort of approach, those sorts of strategies, keep alive. They never die, because no one's willing to say, hey, this doesn't work. So the willingness to point something out when it doesn't work, and the willingness to be responsible. These 3 are all 3 examples of studies that we were very enthusiastic about going into that just didn't work. And we are so grateful that those agencies were working with us and keeping data, because they all thought these were great ideas, and they would still be doing them today, because they had face validity. They seemed like reasonable things to do. The first one was a notification to family strategy about contraband coming into facilities. They wanted to just put people on notice. Well, I'm not going to have time to go through the details, but it backfired. It backfired for that agency. In fact, they were so confident about that was the right thing to do, that they made us replicate the study. They replicated the study in a different part of the state, and had exactly the same outcome, that this is not working for you, stop doing that. And they did, and they reoriented to something else. The one in the middle is really a study of incentives, trying to get people to comply with medication adherence. This is for a population of people with severe mental health disorders. And it turns out that they could pay people a small amount of money. Was really incentivizing. People would take their medicine, even for 10 cents. fruit, but it was very complicated for the agency to administer this. So there were all sorts of logistical headaches. So they tried fruit instead, and people actually were quite motivated by the fruit, except that the fruit kept getting bruised and was also a logistical nightmare. Well, the candy was really easy. They wanted to administer the candy as an incentive, and everyone hated the candy. And that was a good exercise of learning. Like, they learned what not to do. And the next step of this is to give people a choice. Don't give people a candy, give people a choice of a candy. People are very motivated by choice. It's very respectful. So if I can choose to have a red candy or a blue candy or this candy or that candy, I might be more motivated than if you tell me what I'm going to get. And the last one, near and dear to our hearts too, this was a really big deal study. We worked with a state agency to change how they paid out cash assistance to needy families. They saw a big issue in their data, and that people really struggled on the front end. They needed to go on cash assistance. I'm not sure what it's called locally in Australia, but they needed to go on that assistance from government. But the first check only came in a month later, and that these people were not able to get jobs often, that some small hurdle was in the way of them even starting to get towards success. They needed a uniform for the job, or they needed gas in the car to get to where they needed to be. And they said, well, how about instead of paying them a month from now, how about we break it up into weekly payments? And in fact, there'd been a study from Harvard that had shown from a county level study that actually counties that paid weekly rather than monthly had better outcomes, had fewer economic crimes, because people would never had that kind of level of need, because they were kind of meeting it out slowly. Well, it seemed like a great idea. There was lots of good evidence to suggest it was a good idea, but the agency didn't just roll it out. They tested it with us in a randomized control trial, and we were only a few months in and we shut it down. Because what they found, because along the way, you also have to listen to people and learn from the field what's going on, even though this sounded like a great idea, even though there was an evidence base suggesting this was a worthy idea, a few months in we recognized that many people in the study group were not able to make rent. That sometimes lumpy payments, those monthly payments, can make a big difference. People who have lumpy things that they have to take care of. And what the state was able to do was learn from that and say, okay, what we can do now is have a small cash infusion on the front end, but then go back to monthly payments, because that helps our public thrive. Again, for their community, that was a better approach. We also really want to encourage our partners to use their own data to answer questions. We often find that there's often data sitting there that's going unused, and that data very quickly, put a smart data scientist in front of a data set, and suddenly you have questions that people have had for years that are suddenly being answered. And I'm going to take you through kind of a silly example of that, but the lesson applies much more broadly. We recently had Halloween, and we did actually have trick-or-treating in my neighborhood because our COVID numbers are low enough. And last year for Halloween, we put this out for our Halloween Hello Pracademics newsletter. And what had happened, we were doing some work with policing organizations in Canada and Mexico and in the US, and people kept talking about the lunar hypothesis and how they would think about officer manning or planning around the time of a full moon. That if there's a full moon, there's a host of negative outcomes associated with that, and they wanted to be ready for that increase in mental health calls or the increase in public service calls that comes around when there's a full moon. And the officers were really convinced. It's the lunar hypothesis, and they were really convinced by this. So we asked them, can you just see, you have your data, you have your incident calls, can you just see if this actually holds out? We know the phase of the moon, we'll have the data on that, and you have the incident data. Let's just take a look. So in 3 countries, we quickly teed up a lunar hypothesis study, and there's multiples of these. And what we found, if they just looked at their data and we showed them exactly how to ask questions of their data, that there was no relationship at all. And in fact, this is still one of our least popular studies with police, because they still convinced it's true, and we keep having to take the new agency's data and convince them too. So we've repeated this many times now to demonstrate that eventually we'll find an agency for which this does hold, but so far we haven't. But the idea there is, it doesn't have to be a big deal. Use your data, ask questions of your data. Sometimes you can ask questions just by letting your staff be curious, and then doing some simple testing within your own data. Another thing, this is becoming so easy to do, so much easier, right? Thanks to lots of software tools that are already out there. We often do this by producing our own software. We are kind of creating our own software for agencies we work with, but often even existing tools go a long way. See if there are ways to dashboard if you aren't already doing it. A simple dashboard on process measures, a simple dashboard on case characteristics. If you have outcomes data already in your database, get it dashboarded. so that in real time, your staff can start to see what's going on. And we've seen amazing transformations and reforms happen when that delay of information isn't there, that people just in real time can see what's going on. So this is how, just to take you through a little bit of kind of the nuts and bolts, this is how BetaGov often is involved in research. And when I say BetaGov's role in your research, I want to start by saying our role can be many things. We often talk about being a group that does soup to nuts. Like remember when we could go to restaurants, and if you went to like a fancy restaurant, you had this opportunity of starting with the soup all the way through nuts at the end and everything. You had to get up the 7-course meal or just the one entree. So we could have no role in your research other than saying we are champions for this idea of learning, and that is our role. Our role is to cheerlead you and say, go at it. Get in touch with your data, collect data if you don't have any, empower your people to ask questions. But if we are collaborating together, and again, even within our collaboration, it could be a tiny role or a more substantial role. It really depends on the project. This is what our role can be, or it typically is, with a collaborating agency. So we start at the beginning in design and help with that design. So we start to think about drafting the descriptions of what this intervention is going to be and what the analysis plan might look like. What is feasible? What sort of study can be done here? And what might that analysis plan look like? But before we even get there, we like to make sure that we understand the study in context. So that means we have a team at BetaGov that would do the literature reviews. What else has been done? What do we know about this thing? Or things like it, right? Just so you know that you are also have the benefit of knowledge of what's come before you. Not to say, hey, go do that, but just to make sure that you're informed by any learning that's happened before. We also like to help to prepare scripts for staff and study participants. And what we mean is, if you're starting to do an evaluation or test something, you're trying a new innovation, how do you talk about that to your colleagues? How do you talk about that to study participants? There are more helpful and less helpful ways to do that. So we like to even give some kind of template scripts of, hey, this is a productive way to talk about research within your agency. We also, if there's surveys involved, sometimes it might be a reason to collect that sort of information, pre-survey or post-survey, we can help in the design and the collection of those surveys. And then there's also kind of an initial pracademia training. We have a 1-hour webinar where we onboard our new pracademic partners. There's no cost to being in pracademia. You would come to us, we'll take you through a webinar and share a little bit more detail about how this kind of BetaGov model works. And then if you're working with us on doing an actual pilot together, there would be subsequent touch points to make sure that you're really having, if there needs to be any skills transfer, that you're learning those skills along the way. And then also, very importantly, ethical issues are paramount. So making sure if your agency has any ethical review protocols that's specific to them, helping you prepare documentation for that, or whatever the ethical reporting requirements are, to make sure that you're always being mindful of that and that everything is being complied with. On the analytics side, we are available to help with analytics and also to troubleshoot with any implementation issues that arise. We always encourage our partners to check in with us. We've done so many pilots now, across the US and in other countries, that often implementation issues might come up in a jurisdiction. And if they haven't had that much experience, it might seem insurmountable, or it might be kind of complicated to think through how you might resolve that. We've had lots of experience doing this, so sometimes we can help you troubleshoot your implementation issues. So both on the analytics side, but also the implementation issue side, please reach out to us and keep us informed. We'd love to help you think through those issues. If you're doing a randomized control trial, we have a BetaGov randomizer that we created for pracademics. It's easy to use and helps you make sure that you have a balanced study, so a higher quality research project. So you can use ours, you can use yours, whatever makes sense. It would help you think through randomization. And then research issues that come up. Something's going to happen. Life happens. These are pragmatic field experiments or field tests or pilots. Things are going to happen. We can help you think those through. And then we're here to assist with data analysis. Some people we work with have very large research shops. They're perfectly capable of doing the in-house analysis themselves, and that's what they want to do, and that's absolutely great. More often than not, the agencies we work with prefer, if we have a data sharing protocol, secure transfer of data. We are very careful about how data is managed, and we do the outcomes analysis for them. But it's absolutely up to the partners to decide. And then we want to make sure that others get to learn from you. We help with dissemination. It's really important that both the good news and the not so good news be shared. What we do with agency partners is recognize that some agencies are risk averse. If something didn't work out, they don't necessarily want the world to know about it. So what we say is, well, how about the opportunity to anonymize? Some agencies are very proud to say, hey, we tried this and it didn't work, and articulate that. Others prefer to say, hey, we tried this in the western part of the country. We don't name where they're at, but we do allow the lessons to be learned. And that's something we really want to kind of encourage within our network, getting the message out so that others can learn from you. We like to announce the work that you're doing on social media, post updates. We'd like to prepare there's those snapshots that I showed you, the names, the authors on those are written for them, but the names are the pracademics. The pracademics are credited with the learning that has happened in a one-page snapshot, which we have found is the magic number of pages. Long research reports rarely get read by practitioners in the field, and often by decision makers themselves. Now, the research teams might do that, the analytical units might do that, but a lot of people where there's great value that they get that information just don't, because of these lengthy research reports that we create. We've tested the magic number. The magic number is 1. You're most likely to get someone to click on the research and actually look at it if you have less. So less is more. So we distill the results to a one-page snapshot so that we maximize the number of sets of eyes that will get onto your research, or the number of people that will consume what you've learned. Right, so that's what we do for our pracademic partners. What about our expectations of you as a pracademic? If we're going to, investing, we're going to put the time into working with you, we want to make sure we get to a product that we can learn from, an intervention experience, or these pilot tests that create value in terms of creating knowledge. So your role, we want to be able to count on you, and this is what it means from your end. First of all, is really being the fountain of ideas, right? So bring us your ideas. Let's think about whether they're feasible. Can this be done? When we're thinking about feasibility, we really have to be in conversation with you. We can go back to our drawing boards and try to do as much as we can to think about whether this is viable and feasible for you. But you know more about your agency, you know more about your community, you know whether this can actually be lifted. So that front end, it has to be collaborative as we think about what is feasible. We also want to make sure that you're kind of contributing to the design. We'll have the academic team on track with you to help you through this, but to weigh in on whether the ideas that we're giving you are ones, again, that are feasible. We want you to review the materials we prepare for you and approve those study descriptions. Is the study that we're designing with you one that is viable? And then help us understand the human research oversight issues that are required in your agencies. We know what's required of our university, what is required of your agency, something we're going to have to rely on you to help us navigate. And then we're going to ask, if we get to launch and we have a pilot that's active, we do believe in nimble research. In fact, we support agile research, so that's research that can change along the way. But we do ask that you not change the trial design or the pilot design or change the methodology without checking in with us. And the reason we do that is we want to keep data around that change, so when we do outcomes analysis, we can be responsibly reporting on what actually happened. And then, of course, communicate with us. We love what you're doing. We want to know about it. Just let us know how things are going. And then again, let us know if implementation issues are coming up. We want to hear about them. And finally, if we're doing data analysis at the end, we really want to make sure we have strict protocols over data sharing. We want to make sure that you comply with our protocols to make sure that we never violate privacy of the people that you're working with. And we can share with you our protocols, and we ask that you comply with our protocols around any data sharing if that happens. So in a nutshell, this is how it works. You submit your ideas to us. We vet it with you and your leadership to make sure this is something that's feasible and viable, that there's the political will to proceed. We're happy to also help you in speaking with your leadership. Sometimes it is helpful to have us with you, or you bring us in after you've introduced the idea to kind of continue that conversation with your leadership. There's an introductory 1-hour webinar where we talk a little bit more about the process in more detail. And after that, you'll be assigned a BetaGov team, which works in much greater detail with you to start designing your kind of the template of your pilot. What is this pilot going to look like? And with your BetaGov team in place, once we clear ethical review and have an agreement on what this is going to look like, off you go. Let the learning begin. And our goal here really is just to create kind of a global network of people who are working for public good, right? Working on something that has the opportunity to move the dial in the service of the public interest. And so we're really interested in partnering with those kind of social sector innovators who want to create knowledge in their organizations and share with others, because we have so much to learn from each other. So whether it's a big idea, some of our pilots have been really huge overhauls for our partner agencies, and some of them have been small nudges, and we love all kinds, whether it's a big idea or a small idea. We hope you'll innovate with us. And with that said, I'll hand back over and stop sharing and hand back over to you.